Thank you. How you guys doing this morning? It's a little cold in here. Is it cold? I know, my hands are freezing. So I'm going to try and keep it kind of light. This is the first lecture, and you guys are going to have 2 days. So it gets a little taxing by the end. If you can't hear me, let me know. I tend to get louder the more excited I get. So it shouldn't be a problem. So I'm going to be talking today about common testing and treatments for the newly diagnosed patients. I always have to give this disclaimer, it's generic, but it is true that really what the advice I'm going to give you today is not meant for you to take it and go do it yourself. You should have the guidance of a medical provider doing this with you, and also that some of these treatments are not FDA approved, they're off-label. So Nicole did introduce me. I went to UCSD. I got a background in nutritional wellness. I am practicing medicine at Dr. Rosignol's office, Rosignol Medical Center. I've been there for over 3 years. And I do see a lot of new patients. I do a lot of new intakes, so that's kind of why I give this speech to talk about what that might look like when you come in. A little bit just about my story is that I got married in 2008, and after several very difficult years of trying to get pregnant, we finally got pregnant with triplets, which is a total blessing. They were born, and my kids were seemingly perfect, as all newborns are. But as they developed, really everything was pretty normal. There might have been, now in retrospect, a couple things, but typical development. And then at 15 months, you guys know the story. Interestingly, my son, there in the center, he was the first one to show symptoms, and his symptoms were that he started to shake, and every morning I would see his body like shaking. And he seemed to just be really out of it. He had a hard time speaking, and I could tell he was really unwell. So I, went through the medical testing and, through his regular doctor, and we ended up in the regional center. They said, oh, it looks like autism, which I had not suspected at all. So we're doing all these workups and regional center treatments, and then that following summer, my son, Alexander, he went from being a typical developing 25, 24-month-old, 2-word sentences, smiling, pointing, hi, Mom, all that, hugging me, to completely loss of everything. He stopped talking. He started just spinning in circles. He started smearing his feces all over the wall, and he wouldn't look at me. He wouldn't hug me, and I lost my little boy. And I mean, even it's really hard to have a son that regresses that severely. And on top of that, I mean, literally 1 month later, my daughter started having seizures. She started having absence seizures. And I mean, my 3 precious things, three most precious things to me were, I was losing them, and I knew I was losing them. You guys know the story. You go to your doctor, and they want to put they wanted to put him on risperidone, anti-dopamine. I mean, this 2-year-old that's clearly sick and lost, mentally. And, I knew that the system was broken. The mainstream medical system for treating autism is completely off track. So I got, after 6 months of complete depression and just feeling so hopeless and helpless and not knowing where to go and how do I start and, what do I do? I said, I got to stop feeling bad for myself. I didn't do this. I didn't cause this. This is not my fault. I have to do something. So I started going to MAPS. I started getting more info, going online, going to TACA, just like you guys are. I was here about 6 years ago, and figuring out what I needed to do. I went and I met Dr. Rosignol at MAPS. I just walked up to him and I said, hey, I need to learn this. I want to do this for a living. I need to help kids. I want to help my own kids and other kids. Hire me. And he said, okay. And so, this is where I am now, and this is my goal, is to help everybody make progress, because now, at this point, my kids are 7, they're in school, they're in 2nd grade, they're finally, this is the first year, all 3 of my kids are in general ed, so I'm so happy about that. They're all talking, they, have some social lives. I mean, they're really doing well. They have supports and services, but I truly never thought, 5 years ago that they would be where they are, and I think that's a gift that I've been given, and it's partly a gift, and it's also due to my hard work, and all of this just relentless. And this is why you guys are here. Everybody here is a great parent that's just really dedicated to helping their kids, and I'm here to tell you that doing this for now several years, the parents that keep trying and keep asking and keep looking, your kids will improve. How much I don't know, when and what time I don't know, but there are answers. These are medical conditions. There are a lot of things that we can treat. So, that's my 2 cents, and we'll kind of dive into the kind of nitty gritty right now of the talk. But what I'm going to kind of run down is the first visit and what that might look like when you come in to see me. And a big part of the first visit is history, of course. I mean, in PA school, they taught me that 90% of a diagnosis, figuring it out, is getting a good history, which I think is true. Really, what happened? When did it happen? When you were pregnant, and maybe what happened to the child early in life, and were they hitting their milestones? Was there history of regression? That's a big point. That might indicate mitochondrial dysfunction, which I'll talk about later. Medical disorders that run in the family, maybe, other family history of autoimmune things, autism. I will also look at, I would love to collect your previous labs, anything you've done from any doctor anywhere, and we'll review those and talk about treatments that you might have done previously. And because that's a big thing, what has worked, what's landed, what hasn't, that might guide our future treatments. It definitely will guide our future treatments. And also my goal too is to try and figure out gaps. What have we not looked at all, or what are you having symptoms of that just really hasn't been addressed? And then I'll do usually a targeted physical exam. These are typically looking for different either nutritional, issues, or different things. If you look at a child's mouth, oftentimes if the yeast is bad enough, you can see a white coated tongue. If you look at their nails, they might be spotted. You can see issues with really low muscle tone, maybe indicating that mitochondrial dysfunction. So we're looking at kind of clues from their body. And then after I do that, I will, start to make a plan. So we'll review, what I maybe saw, what you're telling me that are bigger issues for your child, what we might suspect. So these are different areas that we might look into. And typically I try and touch on all of these, do some basic screenings and to further delve into them. And then we'll do all that. I'll give you some homework, do testing and things, and then you come back for the second visit and we'll evaluate what happened. Did this supplement I recommended help, the fish oil, or was this good, or was this bad? And then review all the testing. And so, well, it looks like he really is deficient in zinc, let's start that, or whatnot. And, we'll tailor it depending on his response. Do we need to be more aggressive or less aggressive? And so, why you're here, and part of what we're going to talk about is what are we testing for? What is it that we're usually going to order, to put a fine point on it. And basic biomarkers, we kind of broke them down into these different categories, which are, fairly arbitrary. A lot of these overlap, but, for all kids, we have basic biomarkers, CBC, a CMP. These things are going to check for anemias, low white blood cell counts, platelets that might be low or high, eosinophils for allergies, maybe parasites. CMP is going to look at electrolytes, liver, kidney function, CO2, which indicates acidosis in the body. I see that frequently abnormal. And so, these are things that you usually get from your standard doctor. A lot of times, from Kaiser, things like that, we'll order. So these are helpful to bring in and we'll look at and address. Other things that are part of the basic category is magnesium. I like to test that. Some kids are definitely deficient, and a deficiency can lead to hyperactivity. RBC zinc, we're looking at a lot of kids with inattention and or food sensitivities, or kind of no appetite. Frequently zinc will help. We'll look at other minerals. There's been some, I like to look at lithium. Sometimes lithium can be associated with irritability. We have the chromium associated with pica, which is eating non-food items. So we can test all these different kinds of minerals, which is helpful. And another really, really, really big one is iron. Ferritin is what we test for. And I see this low in a lot of kids. And this is a basic screening that most pediatricians, should be doing. And these kids are frequently anemic. And so you'll see these symptoms of, insomnia, restless leg, lower IQ, attention problems. I mean, you think about it, iron is responsible for transporting oxygen to the brain. So to the whole body, but also to the brain. So if you have low iron, you're going to get less oxygen to the brain. And this is a very easy thing to correct. So that's another important marker we always look at. Cholesterol. Interestingly, I see a lot of kids with low cholesterol. Everybody thinks that high cholesterol is bad, and with the adult population, we're always trying to lower it. But these kids frequently have the opposite problem. They're either not absorbing enough fat, or for some reason they're not processing it properly. But the low cholesterol can be associated with irritability, aggression, hyperactivity, and so we can correct that with dietary or supplements. Testosterone, I will check for older males typically. We can check females too if we're suspecting excessive hair growth or things like that. But I do see some hormone abnormalities with these kids, and a TSH, which is a thyroid stimulating hormone, it's associated with developmental delays, and I do see this abnormal in a fair amount of kids, young kids. And so even if there's no family history, if there's a family history, we always test, but even if there's not, we test anyway, because it can be associated with developmental delays, for sure. So moving kind of over into the endocrine system, not necessarily important, but another thing we might test is cortisol. I see a lot of kids, and maybe this might be related to the lower cholesterol, because if cholesterol is low, cholesterol helps produce cortisol, but a lot of kids have low cortisol. So that's kind of your stress tolerance hormone. If your cortisol is low, you're not going to be able to take any kind of external stressors, whether that's emotional or physical, physiological. So these kids have a lot of meltdowns maybe, and so that's something that we can look at and treat and address. As far as the thyroid, if we do a thyroid screening and it's low, then we definitely will look at thyroid antibodies and more complete thyroid hormones. As I mentioned, this is a big part of development and making sure that the child's brain is growing properly. Vitamin D is huge, 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 huge. So I check every kid always for vitamin D. It's almost always low. I mean, it's kind of crazy. You'd expect some kids to have decent levels, but if they're not on supplementation, they are typically suboptimal. And what that means, in my mind, when I think about it, is vitamin D is an antioxidant, but more importantly, it helps maintain that mucosal barrier in your intestines. So if you have low vitamin D, you have a higher risk of having inflammatory bowel disease or leaky guts or intestinal permeability, because you don't have that mucosal layer to protect and to keep the bacteria and everything else inside the GI tract. So vitamin D, got to keep it up, so we always test that and make sure that that's in an optimal level. Biomarkers of immune dysregulation. There's definitely a lot of immune dysfunction that I see with these kids at all different ages. So if we're suspecting that the child's getting sick frequently or seems to have chronic infections they can't get rid of, we will definitely do more in-depth immune testing. And IgG are kind of the long-term immunity factors. So we'll see those low in a lot of our kids, or some of our kids. I wouldn't say a lot, but they can be related to definitely core autistic behaviors. IgE might be associated with allergies, so if that's high, then you'd expect the child to maybe have more rashes or asthma or hives, that kind of thing. ANA, I see elevated pretty frequently, even in my own family, unfortunately. It affects autoimmunity in the sense that it basically makes antibodies that attacks the own cell. So kids that have a lot of inflammation or something's triggering their immune system might have these elevated. So we know to start addressing inflammation and trying to calm down the immune system. C-reactive protein and SED rate, again, other immune inflammation markers. And then this next point is really important with the folate receptor antibodies. It's associated with cerebral folate deficiency. So what that means, and it's so important to me that I made a whole nother slide. What that means is that basically the body needs folate to grow. It needs folate's vitamin B9. It needs to get into the brain to help it grow properly. And the body in these kids, up to 75% of these kids have these positive antibodies that block or bind to folate to prevent it from getting into the brain. So these kids functionally have low folate, and their brain's not growing properly because of these antibodies. And we found that really addressing these and treating these can really help some of the core symptoms of speech and cognition. I have seen really good success in a lot of kids I treat in my own personal family. So the thing that elevates these antibodies really is dairy consumption. So there's something called molecular mimicry, and you don't necessarily know that, but with dairy, you'll produce these antibodies for the folate receptors. So removing the dairy will calm down the immune system and stop producing these antibodies. So the number one treatment for this is reducing any dairy exposure, any cow, milk, and actually even other milks of other animals, even camel's milk, unfortunately. And without treatment, if you're not removing these things, the numbers tend to go up. These antibodies go up over time. So you might see kids that are, not making any progress or even seemingly getting worse over time. So, and we will also treat this with just high-dose folate. And so this is definitely treatable, and it's a large cause of disability for these kids. Another biomarkers of immune dysregulation, we have ASO and anti-DNase. Those are basically strep antibodies that's shown either previous or current exposure to strep. And I see these, maybe this kid has a chronic strep infection we need to treat and address. Anti-gliadin antibodies are antibodies for celiac disease. So if you have a wheat intolerance or wheat disease, then I do see kids with these elevated, and we definitely need to take away that wheat. Food allergy panels, we can do IgE and IgG. I broke this down on this next slide to kind of just discuss it. It's a little bit confusing, but when you break it down, it's actually fairly simple in the sense that IgE are mediated by allergies. It's true allergies. So you can do I usually do a blood test for this. I mean, you can do skin prick tests. There's a lot of different ways to do it, but easiest is just getting a blood, because you're gonna have to get snip blood anyway, unfortunately. And this will be the kids that have actual, they eat nuts and they get a rash, or they have anaphylaxis, they have problems breathing. The IgG is going to be a lot more complicated, because IgG is basically your body's immune system just stimulated and making antibodies. It's not a true allergy. So you might see some strange issues with kids, like maybe joint discomfort, stomach problems, maybe they get really mucousy or hyperactive in response. And this is also a blood test. So we can test these and see, is the kid reacting to what kind of foods and or environment. You can also do this for environmental exposures, such as grass and ragweed and kind of thing. This is, like I said, you can do blood tests for both of these, but in my experience, when I'm looking at what is my child reacting to, I used to do a ton of testing, and I found that it was just different every time. Every time I tested it, it would just seem to move the mark, and I don't know if it was maybe they had more intestinal permeability one time, or because we were eating different foods, but the most fail-safe way is to just do an elimination diet. So in my family, we have this kind of like the dinner test. So we're at an age where I can have them all sit around the table and we cook dinner. And usually when we start dinner, they're pretty calm. And, if by the end of dinner, if we're 5 minutes into dinner and somebody's getting up and bouncing around the table and, jumping upside down and making weird noises and just kind of acting hyper, I'm thinking, what did I cook? What I have to look at this meal. There's something they're reacting to. But if everybody finishes the meal relatively calm and says, can I, go play video games now, or whatever they want to do, then okay, then that was probably not a high allergen food. So by that process, I kind of figured out, okay, my one son does really horrible with corn, my other son is really bad with wheat. And these are not very, scientific. I mean, the best way a lot of parents would, recommend a total elimination diet, where you take out every food and then add in one food at a time slowly. And you can do that, but it's very effective, but it's very difficult. I mean, just coming from a parent standpoint, you want to feed your kids food. So it can be time. I mean, I think that the diet can be, just coming from a mom perspective, is one of the hardest things with autism. Like, what do I feed my child? Because you're really, it's stressful. You want them to get nutrition, but it can't be this and it has to be that. And so just watch your child. That's my best advice. That's, I just see if they're eating and they don't seem like they're reacting, then they're not getting bloated, then it might be okay. Food allergies, just to kind of touch on that a little bit, is just that, this is my, my speech about the dairy. Usually on the first visit, I'll talk about, we should try a dairy elimination diet if you haven't already. There's been studies that have shown that it really, it basically activates the immune system, that these kids seem to have more behavioral symptoms, and that, that it does disturb their central nervous system. So, usually a good trial is going to be at least 6 to 8 weeks. If you take it out for 1 week, that's not usually going to be beneficial. And, it's good to just, like I said, just watch your child, see how they're reacting, what's happening, what's not, are rashes going away, are things getting better. And I wanted to talk now about the next set of markers we do, kind of moving on. And this is really big, of course, because it's the GI dysfunction. Probably almost every kid in this room has, the kids of the parents in this room have GI dysfunction in some way. I mean, it can be very, very, very subtle, and it might not even be noticeable to anybody, even the child, especially the child. But when we start analyzing it, we really see, when we do a stool, we see abnormalities. And a lot of these things will come up positive. So I'll collect the stool, we'll send you with a kit, you collect it, send it off, and we'll see that stool calprotectin might be elevated, which is an inflammatory bowel marker. So like ulcerative colitis, Crohn's disease, that would come up positive for these, and I see that high sometimes. Stool eosinophil X, so this is an allergic reaction in the gut. I frequently see this high in kids, so maybe they're eating things that they're allergic to, and you don't know. Bile acids, enzymes, pH, fatty acids, these are all different kind of indicators of how well your child's digesting their food, and this is often abnormal too, and so this can let us know how to further treat the child to help digestion. And then another big part of it is the stool culture. We'll actually take it and grow it in essentially grow it in a petri dish, and then it'll come back with what's in the feces in the lower intestine. I always talk about the GI dysfunction pretty much at all my visits. I spend a lot of time because it just seems to be a big issue. In the one study, they showed that 43% of autistic patients had intestinal permeability, so leaky gut, compared to their controls, had none. And even, interestingly, there was a high percentage of the family members. So these kids with autism, one study showed that 36% of them had IPT, which is intestinal permeability. And so 36% of the autistic patients had increased intestinal permeability, but their relatives had 21% compared to normal subjects, which is only 4.8. So basically the families of these children with autism may have GI dysfunction too and not realize it. So a lot of these issues might be inherited, maybe because it's something genetic, but I think it may be more likely that we're actually sharing the microbiome of our family. So who you live with, and who gave birth to you, and who gave birth to that person, and who they intermingled with. These things do matter. So sometimes I'll try to give the parents a little talk too, like, hey, we should all be eating healthier too, because we're all living in a petri dish. That's every house is. So working on everybody's GI health is always a good thing. When we're doing the stool cultures, this was kind of going back to the stool culture. This is a typical, maybe a little extreme as far as the pathogenic, the bad bacteria, but the top part, the beneficial bacteria, is very typical. So what I see with a child is that they often do not have beneficial bacteria. So NG up there on the left here, the little bubble says NG. It stands for no growth. And you want that to be 4+. That should be high. You should have a lot of lactobacillus. You should have a lot of E. coli. You should have a lot of bifido. Those are going to be protective. That's anti-inflammatory. They fight off the bad guys. They do a ton of things for our immune system and our nervous system. And most of these kids just don't seem to have a lot. And then because of that, or maybe in addition to that, they have number 13, the additional bacteria, they have a lot of bad bacteria. So NP stands for non-pathogenic, which is debatable. And then, but PP stands for potential pathogen, which means that they're bad. They're dangerous. They're bad for your health. They're making you sick. So this child had three different ones that are huge growth of bad bacteria. So this child is gonna be a mess. I mean, I can tell you, I don't know who this child was, but there's going to be behavioral issues and GI issues, and, the stool is going to look like a mess. So we have to treat this one way or the other. Mycology, number 14, also he grew to, or he or she might have grown, different kinds of bacteria, yeasts too. So, we definitely need to be addressing these either with antibiotics, antifungals, prescription, or we can try herbs too. Or, we can try, there's a lot of things you can try depending on, what the parent wants to do and the need of the child. I mean, I'm really flexible with how we do this, but we got to do something. It's cruel not to, in my opinion, because they're struggling. The stool culture, then I just showed these slides to show that when they do them, they actually give you the results of what they're susceptible to and resistant to. So that means it might guide our treatment. And they'll also tell us herbs. Like, oh, this Proteus is susceptible to berberry, so we might want to use that herb. So it's helpful. They'll give different ones for different bacteria. They'll tell you about yeast too, which ones you might want to, what substances you might want to use to treat it. And then this is kind of moving on to, it's another part of the GI dysfunction, and the sister test to that is the OAT, in my mind, is the OAT. OAT is very helpful because you can really test for different dysbioses. So the way I see the fecal test, the stool test, is that it really is representing what's growing in their lower intestine, their colon, because the environment in the colon is really different from the environment in your upper intestine. So if you're getting a stool culture, that's showing what's happening in their colon, but it might not necessarily be happening in their upper intestine. So how do you look at that? How do we identify that? And this is a good test for that because it will show different metabolites, what these different bacteria might be producing. So the stool might look good, but then when you do this, it's like, oh, he's throwing off a ton of yeast metabolites, so he must be having an upper GI yeast issue. Or maybe a respiratory one, or something else. This test will look for functional B12 deficiencies, folate deficiencies, mitochondrial dysfunction, oxidative stress. Gives us a lot of information. So this is a sample test. I actually think this might have been my own son a few years back, which you can see here the top numbers 1 through 9. Those are yeast markers. Those should not be elevated, certainly not at the level that they are. So that definitely indicates we need to treat that. The bacterial markers, 10 through 14, are maybe pathogenic bad bacteria. And then 15 through 18 is showing different Clostridia species. Clostridia can be, different types of them, can be very, very, very pathogenic for these kids. So these are all things that we need to test and treat, absolutely. This is further kind of example of what you might see in an OAT, where you see different mitochondrial markers, energy production markers that we're wasting. When they're high, that's bad because it means they're not utilized properly in the body. Fatty acid ketones, that basically means that they're not utilizing their fat properly, so that's not good. We need fat for energy. If it's high, it's not being used. And nutritional markers, some doctors don't put a lot of faith in this, and I don't like hanging my hat on, any one particular test, but I think that this can be, an indication. We see, maybe if the B12 looks really deficient here, okay, well, let's try some B12 shots. I think that's a, good indication. So this helps guide our treatments as well. And then also the glutathione is really helpful. Are they having markers here where it looks like they need oxidative stress support? And ammonia, it's all very important. And usually I'll kind of round out my GI testing with just kind of talking about constipation and making sure that the kids are having appropriate bowel movements, because what I find is, if the kids aren't having frequent and frank diarrhea, which happens a lot, maybe, a quarter of my patients, I find that a lot of these kids are just constipated, and their parents don't necessarily know that, they're not necessarily keeping track. It's hard to know. Maybe they skipped a day, but who's really keeping track if you have 3 kids and you have, work and this and that. Maybe a nanny's watching them, they don't tell you. So, consumption of milk is one of the biggest indicators too of constipation. It's one of the first things we take out. So if the child's eating, drinking or eating milk products, then we'll typically take that out, and it improves. And we see that, there's like these kids that have, if it's untreated, I've seen a lot of kids that'll have what's called an acquired megarectum, where the stools start to get larger in diameter. And it's really hard to treat. It basically stretches out the colon and makes it permeable. So, the point is I educate, look at the stool, because this is a child who, was just standing there and he looked pretty normal, but in the sense that, you couldn't tell he had GI dysfunction, but you could feel his belly, it felt kind of hard, and then you do an x-ray, and he's completely, this is all stool, all the white, that's all feces, completely past his ribs. I mean, his whole belly's full of stool. And this is unfortunately not uncommon. So I kind of give the lecture that this is our friendly little poos here, and what we want to do is do type number 4. I mean, we really want somewhere that looks like a sausage. It should not be sticky. It should not be terribly smelly. I mean, horribly smelly. It should not be little balls, and it shouldn't be. I mean, I hear a lot of kids that say that parents say that their kids, it looks like mashed potatoes. My kids certainly, when they were younger, did. So it's really just kind of lumpy, mushy. That's not normal either. So we want it to look like a sausage. If it's not, then we should be addressing that. So, there's a lot going on there. And, the elimination is really important, because a lot of things we're going to do, we're going to try and detox them. We're going to try and put them on a healthier regimen. We're going to try and, treat the yeast. But if they're not pooping properly, if they're not eliminating their waste, they're just going to keep reabsorbing these toxins, and they're not really going to get better. So the first thing we need to do is treat this constipation. So this is a really big point I always make. Make sure, we got to get them pooping first. Get that motility going. Get it out. Get the stool out. Get the toxins out. The bile out. So on that note, one of the last things that we'll look at is toxicity and heavy metals. Usually sometimes this will happen on my first visit, sometimes this happens maybe on the second or third, but I usually do a basic screening for lead and mercury. Those are always helpful. I might look for, blood levels. We can do hair metal testing if we really suspect, we had a big lead, exposure in our water. We didn't realize the pipes were not good or whatnot. So we will test if there's a big suspect with hair metals. The best way, if you're really concerned and you think your child has a metal toxicity, is to do a provoked challenge. What that means is that, you go see your doctor. You should not do this on your own. Measure the urine, you measure the urine 6 hours, get those levels, and often you'll see it's normal. Like, oh, my kid doesn't have metals, it looks pretty good. But then once you give them a chelating agent, either IV or suppository, then after 6 hours you collect their urine, and you'll see a ton of metals coming out. So there is maybe just stored in their tissues, and their body's not able to extract it. So just because you have a normal screening in blood, which is why I don't do it that often, because there are so many false negatives. You think, oh, it looks fine, but it's really not. This is an example of a child that after we did, the first test looked pretty normal when we tested the metals. And then we gave him a chelating agent, and we had him collect the urine for 6 hours, and this is what came up. So this child, the upper limit's 5. This child was at 73. So it's very, 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 very lead toxic, which is very poisoning to the brain. So, maybe this child's autism symptoms were largely in part due to lead poisoning, and he just couldn't excrete it. So this is something that we need to treat and look at. I think, most kids on the spectrum, we should be at some point looking at, getting a good metal analysis. I've been talking a little bit about mitochondrial dysfunction. I know that's a big word. And to kind of break it down simply, this is the picture of a cell from, Bio 101. And the mitochondria are that little red organelle, a little peanut-looking thing. And basically, this is the inside of the membrane of that. And the whole thing is responsible for making energy for the cell. It powers the cell. It's the powerhouse. So this is a kind of a slice of the membrane and the inside of it. You don't need to know any of this. I won't talk about any of this. But basically, we measure a lot of these things. We measure these markers, and we can. And when these are really elevated or significantly low, we'll know that there's a dysfunction somewhere in there. And without proper energy, this is where the lead might become toxic. So that's kind of why a lot of these things are relevant, is because some of these toxicities interfere exactly with this slide. They will prevent energy, they shut down the cell, and you will not get a functioning cell. And then you get a child that's not talking, and you don't know why. And so I really, really try and emphasize mitochondrial dysfunction, because I think it's sometimes things that get overlooked. Dr. Rosignol, Dr. Fry are really big on this piece, which I completely agree with. You know, these are all different things that we can, and we do test for a lot of these at the initial visit, maybe half, I would say. I mean, it's hard to know depending on the child, but you know, I feel like a mitochondria sometimes gets missed by some doctors, and I find that when we're really targeting that good energy production, you're going to see more speech. You're going to see, you know, an improvement in cognition. So this is just going to let me know that basically, I don't need to review this, but this is from a paper from Dr. Rosignol and Fry, and just that we're going to treat. Essentially, these are symptoms of mitochondrial dysfunction. Maybe I see a lot of weak muscle tone, low speech, motor difficulties, handwriting difficulties. But we would treat with these different things down here: carnitine, CoQ10, B vitamins, antioxidants. But that's not all inclusive. I mean, those are a few things, but there's so many more. So again, this is why having a doctor's visit is really important to help optimize that. And then seizures. I just wanted to touch, I only have a few minutes and I want to do questions. So seizures are important to look at least once in your kid's life. You get a 24-hour, you know, you need to make sure that the speech impediments or some issues are not coming from subclinical kind of issues in the brain. I mean, frank seizures are easy to see, but a lot of times these kids have abnormal EEGs and we're not seeing it on them. But they look horrible when we test them, or they look abnormal, and so we know, okay, we need to address this. And we don't have to put them on meds. Addressing it doesn't mean meds necessarily. It might be optimizing mitochondrial function, removing the lead, removing the toxins, but this is a good measure for us to see how their brain is electrically working. And so yeah, this is a summary of things we might do. I don't normally do all of these, but we might add more or less, but I just kind of lumped them for your guys' reference. This is, we talked about the other initial testing we might do. You want to see a medical provider. Don't wait. You know, they will help you assess this stuff. Other considerations, I do always kind of talk about allergens, mold. I kind of ran out of time to talk about that. Assessing for toxins, like we said, maybe genetics. But usually that doesn't happen at the first visit unless we have strong suspicion of something. So usually I'll do talk about this Q&A, but I want to get your Q&A instead. So this is my contact information. If you guys want, please feel free to email me. That's the best way to get a hold of me if you have any questions about what we've talked about. And yeah, those are my little babies when they were like 8 weeks old, so they're so small. So thanks, guys. I'd love to take some questions right now. Thanks. Oh, shoot. I'm so flaky, sorry. How long do metals stay in the system to show up in testing? Would metals stay in the system a year after exposure? So when we do something like that's tricky, because if you're not doing a chelation challenge, they're not even maybe going to be in the system. You might get exposed and it directly gets stored in tissues. So it might not come up. Now, if we're doing a chelation test where we're trying to pull it out, it's usually a matter of hours. That's why we do a 6-hour test. So it's not like you can chelate them and then test them 3 days later. It usually doesn't work that way. Yeah, it's usually a few hours. And then would metals stay in the system a year after exposure? Yes, absolutely. Because it really just depends on the child's excretion. There's different lectures here about metals, but they've shown, I mean, the kids will retain these for years and years. So a normal child might be excreting them as their a neurotypical child might be, excreting them as they're being exposed at age 2 or 3. But these kids don't seem to even start excreting them till I think age 7 or 8 on average. So I've attended lectures on this, so definitely you can retain them if you're not excreting it. What tests are good for kids who have Asperger's and OCD? So OCD is kind of its own. A lot of people kind of associate that with pandas. Dr. Rosignol, his theory is maybe it's a lot of Clostridia exposure. I think that might be true. I think the kids with the bad pathogenic Clostridia tend to get more, OCD symptoms, but it's a very complicated question. So I would usually do some immune panels, check for strep, test for, maybe do a Cunningham panel. There's, which, it's pretty confusing, but definitely. There's several. Can we go to Biomed Maps doctor even if we haven't started gluten-free, dairy-free diet? Oh, I love this question. Yes. Yes. I mean, that was part of my slide I skipped, was that wherever you are in your journey, go see your doctor. We're not here to judge. I mean, you know, in the sense that you haven't done this or you haven't done that, or, oh, my diet's so horrible, or I'm still on this thing that I shouldn't be doing. Just go. Like, I really want to help. There's no good time but now to go, because, you know, we need, you know, we'll take you off for wherever you are. I see kids that have been doing this 10 years. I see kids that just got diagnosed. Their parents don't even know what autism is, you know, what that means. And so, yes, Eddie, go now. Go yesterday. Do I need to take a doctor to an oat test? Oh, do I need a doctor to take an oat test? Yes, you will need a doctor to sign for it and a signature, because legally you need a license to be able to interpret it. So you do need a doctor to order these tests. I tried removing milk, nothing happened. How long should I try to know if it's helpful? Like I said, a good elimination, I mean, is at least 6 weeks. I mean, the purists will say 6 months, but I would say 6 weeks to see if you see improvements. But again, it's so insidious, because if it's something like that cerebral folate deficiency where they're tricking these antibodies, the antibodies are going to take months to go down, and then you're going to take even more time to get the folate up. So sometimes it might not be 6 months, or not, a year. So you know, these are things we test for too. So that's where the testing might be helpful too, to see how quickly we need to remove the dairy. My doctor won't order a 24-hour EEG. Yeah, so you got to find a good doctor. So if they're not doing these things, I mean, if they're not even willing to order these things for you, then they're not going to know how to interpret them anyway, and then they wouldn't know what to do with it. So you really need to find an expert that's dealing with autism specifically, because you might be able to get them ordered and then take those results to a MAPS doctor if you push really hard. But you know, it's going to be it's a journey. It's a marathon, not a sprint. So getting up somebody that you trust through this whole process, whoever that is really going to be key for your sanity, for your health, for your child, you know, for long term. Where do we start aside from testing? That's a good question. So I mean, I'm a big fan of diet. I think diet's huge. I think that a lot of this issues is coming from our poor quality of food. You know, we have pesticides and we have glyphosate, which is Roundup, and it's an antibiotic, and it's in all of our food. And so I am such a believer that we're kind of the society is poisoning our kids. And so eating organic, eating clean, cooking your own meals, I mean, I think that that's probably the best thing you can do, aside from the meds and the supplements and diet, or the testing. Because our food is just really poor, and it's not even bad quality at this point, it's actually toxic. So yeah, just cooking, just buying organic and cooking, and trying to see how your kid's feeling is a good place to start. And are we done? Oh, yeah, okay. What method of provocation do you feel is safe to check for metals and toxicity? We can do either. We can do IV or we can do suppository. I mean, I think that both can be safe depending on how the amount you're doing and the health of the child. So a lot of that's why I usually don't do chelation at the first or second visit, because you really need to they have to be pooping, they have to be, properly, they have to be having adequate levels of minerals and zinc. And so that's kind of a question we usually do later on and see how healthy the child is, because you can't start pulling metals before you get some of these systems working better for elimination. My child is irritable. How do I know which supplement to start with? Yeah, good question. That's obviously a good one for the doctor, but irritability, like I said, I'm thinking cortisol, I'm thinking toxicities, I'm thinking not sleeping well, maybe melatonin. These children don't sleep a lot of these kids don't sleep, so of course you're going to be irritable. So yeah, melatonin maybe at night, some theanine. Theanine's fantastic. Fish oil I put on almost everybody on it. We all in this room need to be on it because it's good fat, it's anti-inflammatory, and it helps our brains grow. So those are some good places to start. My son had a test, it's positive in something levels. You know what, I can't read this. Whoever wrote this, just please come see me afterwards. Do we still have... Okay, good. Do I do telemedicine visits? Yes, I do. We, in our office, I think we require an in-person for the first visit. But yeah, I do telemedicine actually all the time, and I'm hoping to do more of it. Because, yeah, I think I'd like to increase the access for everybody, to our clinic, or just, to providers in general. A lot of people don't live next to a MAPS doctor. So yes, the answer is yes. My child's neurologist would only do 1 hour. What can I do? Trial for seizures. Again, you got to get the 24-hour, because here's why. The 24-hour, I think, is most beneficial that first stages of sleep. So you can do an hour when they're awake. It's probably going to be normal. I mean, it might not if it's severe enough, but a lot of kids, it's the sleep portion that it's abnormal. And particularly when they first are starting to fall asleep, you'll see these waves, kind of this irritability come out. Just anecdotally, I've seen in my own son. I think he was having seizures too, that I'd never tested at the time. But he would fall asleep, and I noticed he'd kind of do these weird jerking movements as he was falling asleep. And I always thought, that's odd. And this was before I even got into this field. And I see that sometimes correlate with EEGs. So you got to do it when they're sleeping. That's just really the only way that you get a good test. How can I reduce my toxicity in my children without chelation? Yeah, that's a good one. I mean, again, the number one thing is increasing elimination, getting them, the 4 ways we eliminate things from the body. So we defecate, so we poop, we urinate, we sweat, and we exhale. Those are the 4 ways we're going to eliminate things from the body. So making sure those systems are good. So exercising for the sweat, hydration for the urine and for the sweat. Making sure that they're breathing properly. You'd be surprised, a lot of kids have so much severe nasal allergies and things. I think they're mouth breathing, they're not breathing properly, so you might want to address allergies. And then the stool is number one. They have to be eliminated properly. So, yeah, I have a lot of good supplements and ideas if you guys need ideas for how to get the bowel movements going, because my kids were really hard to treat constipated kids, so I finally have something that works. Is it possible to test for Tylenol? My child has been given Tylenol after MRI. Yeah, Tylenol's it's one of those things that I don't believe, and I'm not certain, but I don't believe it's actually stored. I mean, it should be eliminated, but it does hurt the mitochondria of the liver cells, so certain systems. So it won't necessarily be retained, but it is injurious. So if you get it once, it's probably fine. But just if you're doing it every day on a daily basis, like your kid has a fever and you give it to him every day for a month, that's going to maybe create some toxicities, but it should be eliminated. My child is very bloated, but he has regular diarrhea. Right. So, he's probably, the bloating is usually from, and I find that diarrhea in general is from excessive bacteria. Now, it can be a ton of other things, don't get me wrong. I mean, you can have allergies and you can have malabsorption issues. I mean, there's a ton. But in general, I find that when I test these kids, they have SIBO, basically. They have small intestinal bacterial overgrowth. So they have too much of some kind of bacteria. Or it could be yeast. It could be yeast, but something's growing too much up here. So they're bloated even though they're having diarrhea. Like the body eats it and it freaks out. It's maybe throwing off digestive products that are bad, so the body just says, get rid of it. So they're having diarrhea, but these bacteria produce a lot of gas. So they're bloated even though, as a byproduct, even though they're just eliminating things. So it's really a malabsorption kind of syndrome. So, test for bacteria, do a stool test,